Kaushik sir, respected Dr. Mukesh Chavda, my dear respected colleagues from the Homeopathic Study Circle, dear students and friends. So, I was told, as soon as I arrived, we have done enough of theory. So now we need some clinical cases to lighten up the mood and to understand the autoimmune disorders better. So, because I have always been a student of Organon, the guiding principles of homeopathy. So, uh, without any regret, I always prefer to start all my presentations with some or the other lines of Organon. So, one of my favorite quotes by Samuel Hahnemann in the Organon is what he writes in the preface to the 5th edition. Homeopathy is a perfectly simple system of medicine, remaining always fixed in its principles, as in its practice, which, like the doctrine whereon it is based, if rightly apprehended, will found to be so exclusive and only in that way serviceable, that as the doctrine must be accepted in its purity, and so it must be purely practiced. So if you talk about homeopathy, if you do not follow the basic fundamental principles of homeopathy, it is definitely not homeopathy. So you have to remember that you have to find out the similia, you have to give the minimum possible dose. People often misunderstand minimal dose as single dose. It is not so, but minimum dose, and you have to follow the doctrine of individualization. So it's a very, very simple system of medicine. Now, when we talk about the topic that we have in hand today, autoimmunity. Now, I'm sure you all being students of medicine and seasoned practitioners, you understand it's a rising trend in our clinical practice now to see a lot of cases of autoimmunity coming up. And we also know that since COVID-19, the cases of autoimmunity and autoimmune disorders have also taken a huge surge. Now, why that has happened? Does anybody have any idea why has it increased after COVID-19? So, steroids, for instance, can trigger that. The vaccination can also trigger that. And there's another phenomena of autoimmunity called the molecular mimicry. Okay, some of the molecules, for instance, in brain stem, they resemble the COVID-19 virus. So there is antigen similarity, and that also triggers the autoimmune process. Now, basically what happens is, to put it in a very, very simple manner, so our body has antigens, and some of them are called autoantigens. Autoantigens are basically in cells, there are certain protein components which can trigger a lymphocyte response. Okay, so they are called autoantigens. Now, whenever there's a new virus or bacteria or some other substance coming into the body, and that has something called a heteroantigen. So it's very simple. And now, in order to, now with these autoantigens, also there are some lymphocytes which will be formed against these autoantigens, and this is what happens in the normal human body also. But our body has filters. Okay, now those filters are majorly the primary lymphoid organs, which make sure that all these lymphoids against the autoantigens, they do not create any mischief in the body. Okay, so this is what we understand with the definition of Organon, the state of heightened vitality, where your body keeps all these autoimmune processes in check naturally. Now, some of this autoimmunity is required in the body. So, out of men and women, do you understand who has more autoimmune tendencies? Why? Because of estrogen. Okay, estrogen triggers more of autoimmune tendencies in the body. Okay, now the other thing is there are parts of the body that will die down with time. Okay, there's senescence, and these also have to be removed. So you require a balance of slight autoimmune tendency in the body, but it has to be kept in absolute check. And when it is an absolute check, we call this health. Okay, now next is a stage where you do have heightened autoimmune processes in the body, but you do not have any disease coming up. Okay, this is called the phenomena of autoimmunity. You do not have any pathological changes, but yes, when you do the serology, then you do find some heightened autoimmune antibodies in the body, basically. Okay, so this, when we link it with homeopathy, it's called the latent miasmatic state. Okay, and when there's a trigger, okay, when there's a trigger is when you have pathological changes coming up, and that is called the autoimmune disorder, which we know are rampant. You know, the most common, which is the most common autoimmune disorder in the world so far? It's type 1 diabetes. Okay, and so it's the most common autoimmune disorder in the world so far. Now understand this, that when the body has a tendency, what we call vitality, in the language of immunology we call it tolerance of the body, okay, which we call heightened vitality. Now when we are talking about the autoimmune disorders, you also have to understand what are the causes behind it. So there's called a mosaic of autoimmunity, which means the causes. And what are the causes? What we also know in homeopathy, the genetic predisposition, which we call family history, or the predispositions, or some people call them the miasmatic tendencies, right? The next phase is when you have certain environmental triggers. Okay, and then there are personal factors, which is personal dysregulation in the immune mechanism. Okay, so that's something, you know, which we understand, the host, the possible trigger, and the environment, that triad that we've always been studying. So now the clinical medicine also understands that entire phenomena. Okay, but how homeopathy differs from the conventional medicine is by a simple manner, that for them, though they understand this, but they treat them usually with immunosuppressants or corticosteroids. There is no individualization there. There is no understanding and applying of the entire phenomena. So that's why all they can do is they can give symptomatic relief, but the disease is never cured. What homeopathy, on the other hand, can do is give medications which do not have any side effects or damaging effects, and it can lead to a cure. Now, when I say it can lead to a cure, because so many times there are situations which you cannot deal with, you cannot fight with. So in that case, there will be an effective palliation, but there will be no cure. Okay? So I'll share with you some of the cases, how you'll be able to understand better. So the first case that I share with you is a case which I started treating in 2021, and she was diagnosed with Crohn's disease. Now, she had been my patient earlier, since 2019, because she was suffering with a disease called Meniere's disease, and I had been treating her for that. And so after I treated her for a few months is when she became absolutely all right. And thereafter is 2021 is when she consulted me, because for last 2 or 3 months she had been suffering with recurrent episodes of diarrhea and hematochezia, or bleeding from the rectum. And there was griping, cramping. She had lost about 6 kgs of weight in the previous 2 months. And the other thing was, now, so when you see a patient in homeopathy, what's the first thing that you see? So you always start with the objective appearance. What is the patient looking like? Okay, so you look at the physiognomy, you look at the body language, you see the way in which they interact with you, which will give you a lot of symptoms. Okay, now for instance, she was overtly anxious. She was constantly rubbing her hand. She was leaning forward. She was extremely nervous, restless, fidgety. So they always give you the symptom. There's underlying anxiety and restlessness, nervousness. Okay, so you don't have to ask the patient then, are you nervous? No, it's apparent. You just have to observe and you have to note it down. And She had always been a lean patient, but yes, when we saw her in 2021, she had become leaner. So there was weight loss, and uh, and of course, given that she was about 72 years old, so she did have primary generalized osteoarthritis also. So you could see the Everton notes. So there were these frequent bloody bowel movements with or without cramping, and prior to that she had traveled, she had attended a family function, and she said, you know, she had taken some mutton and she'd had some sweets, and she said, you know, the following days when I started with this and I uh, took a course of anti-diarrheals that did not help, and then I asked my family doctor because she was a retired government officer, so she went to the CGHS and they gave her some antibiotics, and then they gave her some anti-parasitic drugs, but her symptoms continued unabated, and eventually that's when she said, okay, let me go back to homeopathy. And and along with that, she had also started with episodes of urticaria with angioedema. So now that was another thing which triggered further more anxiety, because you know suddenly in the middle of night she would wake up with a swelled lip, or there would be a swelling in the mouth once her tongue swelled up, so she had to be rushed to an emergency. So that went on, and apart from that, like you know, so she had been a patient for Meniere's disease. So she still had a few episodes of vertigo, and you know, instead, because they were very trivial now, did not really bother her too much. And you know, when you go to a CGS dispensary, you're always given a lot of drugs, and one of them was Burton. She said, you know, because I'm majorly fine. Sometimes if I feel dizzy, I do pop in Burton even now occasionally. But yeah. So now this is also which we had in our history, because she'd been our patient earlier. It's because her Meniere's disease problem had started in 2015, where she woke up one day in the morning and she felt, you know, everything is revolving, and she'd fall down on the right side. And every time she would get up, she had this sensation as if she might fall on the right side. But you know, when she would get up and she would go past stool, that's when her vertigo became a little better. And also when she would get up and move around is when she would also feel better. And she had the episodes of vertigo along with coldness in the hands and feet, and she felt better after vomiting or after closing the eyes. So in past, we had treated her with tobacco, okay, the obvious remedy. So so then this was the MRI she had done in between, which showed degenerative changes in the cervical spine. The MRI of the brain, which was also done to understand whether there was any other reason for the vertigo. So it only showed some sinusitis and some age-related degeneration in the brain. So she had been widowed since 2015 and had 2 kids. And at the age of 50, she had suffered with menopause. And she had also been addicted to sedatives and narcotics in order to induce sleep. And there was much anxiety and apprehension. When we saw her in 2021, for the first time, she also said, I have a very strong craving for sweets right now. That's the only thing which I want to have. So this was the fecal calprotectin level, which was checked. And the levels were about 315 at that point of time. So the normal levels are less than 50 micrograms per gram. So that's, you know, considering the anxiety, apprehension, and the nervousness and everything, we gave her argentum nitricum in LM potencies initially, and it produced a slight reduction in symptoms. The episodes of urticaria and angioedema also reduced. The hematochezia also went down a little, but on and off the symptoms kept on bothering her. And then over next 3 months, we also noticed that her urticaria became far more better, but her bowel symptoms and her hematochezia kept on persisting. So now when you look at this kind of condition, what do you understand? That the external symptoms are going away before the internal symptoms. Now this is when you raise red flag. You say, okay, there is something that we're doing wrong, because her internal symptoms are not improving, but the external symptoms are improving, okay? And the general feeling of well-being is not there. She's still not putting on weight. She still has anxiety, nervousness, restlessness, and all of that. So again, we reviewed her symptoms, and then her vertigo came back and came back with the same intensity and with the same group of symptoms. Okay, so again, she said the only time when I have this episode of vertigo is when I close my eyes and I feel better. I also have a lot of sweating. Every time I pass stool, I feel cold, I feel sweaty, I feel nervous. I want to have open air at that point of time. Now, my friends, tobacco also has the entire group of symptoms, including symptoms of diarrhea, vomiting, stomach upset. Tobacco also craves open air like argentum nitricum. And you know, there's a symptom which is there in argentum nitricum with a lot of anxiety, worry. It is also a remedy for episodic illnesses like bronchial asthma, like IBS, and many other conditions, including Meniere's disease, which is also an episodic illness. So that's when we gave her a dose of tobacco 1 m, and she continued to improve thereafter. Gradually, her episodes of hematochezia went away first, her episodes of diarrhea came down, and gradually her urticaria angioedema also came back and then gradually started subsiding. And then finally, about an year later is when we repeated the fecal calprotectin, because she had been asymptomatic for a while, and it came down to 8 micrograms per gram from 317 in a period of about 1 year. And of course, she recovered beautifully. So that is the phenomena of concomitance. And so the choice of tobacco came back because a symptom of vertigo came back with renewed vigor with the same modality. And also, it is important to understand, you have to keep the Hering's law and the direction of symptoms in mind. If you ever find that the internal symptoms are not affected but the external ones are going away, you have to reconsider your prescription. Now, what happens is, Crohn's disease or IBD, we all know, are long-term disease processes. They have episodes on and off, and for almost last another 1 year, she continues to be on placebo, and we did not really repeat tobacco. I think maybe twice in all that we have given her so far, but she's continued to do absolutely well, and she's never ever had the episode of hematochezia and diarrhea thereafter. So what I basically learned from this case is that you need to evaluate the symptom and the patient accurately during follow-up. If you do that, you will save the patient and yourself a lot of trouble. Okay, so
anybody with Urtica 5520, red Urtica 5520, sir वो हटानी पड़ेगा please, it's on the main door. 0845 accent, मैम वो भी हटानी. Thank you.
I remember there was one of my teachers who always gave me a tip that whenever you see a patient improving under a remedy, you must go back and read that remedy properly in Materia Medica, and you will be able to find many more symptoms of that particular remedy which are also there in that patient and which will thereafter imprint on your mind. So I would like to share that with you, whenever you find time, and you find there's a patient improving under a certain remedy, you must try to go back to the Materia Medica and read. So now it is actually a double-edged sword. Sometimes you may end up questioning your own prescription because you might find many symptoms which do not agree. But most of the times what happens is that you end up understanding the remedy better and you find many more symptoms in the patient which will boost your confidence in your prescription. Okay? So, the key in homeopathy is finding the right remedy, and once you are confident of your remedy, you have to allow it to act, because symptoms will improve in their own way, in their own pace, depending on the vitality or depending on the action of the remedy. The art in homeopathy is how to stop your hand from changing your remedy or repeating it too often or too frequently, and allowing the patient and the cure to proceed without any obstacle to recovery, more from your eyesight than the patient's side and environment. So, so this was another case that we saw quite recently, in last few months, and a young girl who had recently been married, and she presented with reactive arthritis, which is also an autoimmune disorder. And we had treated her many years back earlier for polycystic ovarian syndrome. And when we had treated her at that point of time, we had prescribed sulfur to her in LM potencies, ascending LM potencies, and she had responded beautifully to sulfur and had improved considerably. So, unlike the previous case where we went back to the same original prescription, in this case we did not, nor did she give any indications of that, nor did she require that. But she was, her ankle had swollen up terribly for the previous few days after she suffered with a severe episode of diarrhea. And once she had also passed blood in the stool, and it was kind of a painless hematochezia which was mixed in the stool. And thereafter, that episode of diarrhea went away. It was followed by very intense pain, and she had taken some anti-inflammatories and some painkillers, and she had also been given a few doses of steroids. But when she was given steroids, she had a negative reaction, an adverse reaction to that. So she felt extremely agitated, had palpitation, became sweaty, felt shortness of breath, felt a lot more anxious. And that's when she decided, okay, I need to go back to homeopathy, and that's how she came. So, apart from what she presented, was that she had also been suffering with seborrheic dermatitis for quite a few years. There had also been facial hirsutism, which had increased over the previous 2 or 3 years. And she was also habituated to nail biting. So, and she generally stayed a lot more anxious, and that's why, every time we used to ask her a VAS score, a visual analytic scale score for her pain, we always thought, she probably gives you a point or two higher than the intensity of pain that she actually suffered with because of her higher anxiety levels. And since the early childhood, she had also suffered with muscular aches and pains anywhere in the body. And along with that ankle pain and swelling, she also suffered with slight stiffness in neck. And the previous 2 months, she had also been amenorrheic. Prior to that, her cycles had been regular after she had been treated with homeopathy by us. But the last 2 months, she hadn't really had her cycles. So the past history, lots of things happened. So there was a stray dog bite, there was typhoid, there was neonatal jaundice, chickenpox during the early years. She had also suffered with dengue, and as a kid she also recalled passing some worms in her stool. And during the early school, primary school, typically she recalled having morning sneezing bouts which showed allergic rhinitis. And as a kid, she also recalled that she's always had a very sensitive skin after she reacted badly to a drug and developed a lot of erythema on the face. Uh, and then measles also in the early life. Yeah, and then of course seborrheic dermatitis. Family history was quite colorful. Her father had been an alcoholic, and the family history showed diabetes, anxiety disorders, hypothyroidism, osteomalacia, hypothyroidism. So that was about the last ultrasound that she had in 2019, which still showed the presence of polycystic ovarian syndrome, but because she was symptomatically controlled, she chose to stay off the medicines and she was doing fine with it. So generally, because of her work schedule, she was working in an MNC and usually worked in the American timings. So she often, the meals were skipped, there were erratic meal patterns, the bowels were quite regular till the episode of diarrhea, and even after the onset of that swelling and pain in the ankle joint, the bowels had become regular again. And so when she was growing up and during her late school and early colleges, when her father, because of his alcoholic habit, he had incurred major business losses, and the family became in a pretty precarious condition, and that's when she had to take the responsibility, and she started working while pursuing her education, and she took charge. Gradually her younger sister also grew up, she also started working, took charge, and that's how they built their family out. And she also had a relationship for a long time, and it was quite a happy, healthy and supportive relationship, and eventually that was the guy she got married to. And they also had a mutual understanding that she's always going to support her paternal side of the family, and to which the guy and the entire family, they were quite accepting. So not much stress in life per se, and the family even after marriage was quite caring. So the besides now the first most important thing that you have to keep in mind when you have an acute onset of symptoms which is completely into a new domain, you do not mix that acute totality with the chronic symptoms which had been present earlier. So you do not mix and match randomly. Okay, you have to only consider those acute totality of symptoms which are present at that point of time. So the there was no major change in the generalities, there was no other trigger. So the first remedy that we prescribed to her was calibicromicum, because there was an episode of diarrhea and that went away, and that was followed by the joint pain. So calibicromicum is known to have that alternation of the the GIT symptoms with the rheumatic symptoms. So calibicromicum gave a slight relief, but it was still not too remarkable. And then her amenorrhea persisted, the pain was persisting, and then she also developed knee pain. And that knee pain, and then there was a massive swelling in the knee. So it clearly showed that calibicromicum was not the indicated remedy, and we did the MRI and there was massive effusion. So it was only showing some inflammatory changes with effusion, nothing else. So now what we had that was present was a persisting amenorrhea, which was suddenly without any possible trigger. And then we had a joint pain, and that had followed an episode of diarrhea. And there was no other totality available, no other indication available. What she received was Actia racemosa. Now why Actia racemosa? Okay, so H.A. Roberts has compiled a small book called Rheumatic Remedies. It has two parts. One is the Materia Medica section and the other is the repertory section. And the most interesting part of this book is that when you turn it around, you can read from that very side because the Materia Medica is printed opposite to the repertory. So you open anywhere, you can read the book, okay? So in that, there's a rubric. Whenever you have an episode of persisting rheumatism with amenorrhea, there is only one remedy, and that is Actia racemosa. So she received Actia racemosa with a remarkable improvement. The pain went down, the swelling went away, and her CRP came down in a span of a month to about from 17.2 to 6.3. She started walking better, the joint pains went away, and finally, in the month of December, is when she had a period cycle. And then her CRP repeated in the month of January. It was perfectly all right, and that girl has just now shifted her base to US. But thereafter, that initial dose of Actia racemosa, she's just been on placebo and she's done really well. So this is where you find the scope of some regional repertories. You need to read, and you need to always remember, never ever mix up acute and chronic symptomatology. This is where you land up with a lot of symptoms and you end up confusing yourself with all the rubrics in the repertory, and the prior prescription also becomes confusing. So if you just take the totality and you take that time to serve through the Materia Medica and the repertory, you will always find a remedy which is covering that prime presenting totality of symptoms, and it helps you. So I had never ever prescribed Simsifyoga till this prescription for any case of arthritis, though I know it has many rheumatological symptoms, but this is the first time I used it in my clinical practice with remarkable results. This has been one of the most interesting cases that I have been able to treat so far. A case of rheumatoid arthritis and Sjogren's syndrome, both. And when we started treating her in 2019, she had been under the treatment of rheumatologist at Apollo Hospital for the longest of time, and she had been treated with the regular medicines which the rheumatologists prescribe for these conditions like Sjogren's, which includes steroids on and off, and the DMARDs, and the HCQS, and the anti-inflammatories, and the nutritional supplements, and the calcium, and so on and so forth. Because she was quite a lean, emaciated lady, and she was sick and tired of the medication she'd been taking for years, is when she decided to look for other possibilities and other avenues of treatment, preferably in the what we call the alternative systems of medicine. And that's when somebody gave my reference and she came to me for a consultation. The last piece. So, so since 2015 is when she had been experiencing a gradual weight loss and lost about 20 kgs. So I think by the time we saw her, she was close to 40 kgs. A short-statured girl, lady, not a girl, lady, because she was married with 2 kids, grown-up kids. And the husband was quite a heavyweight. And the first time she came with the husband for the history, and husband said, "Doctor Sahab, kuch karo ki hum dono barabar to dikhe." And he was a Gujar, very well fed, tall, broad guy, and she was extremely emaciated. And so it was quite interesting. And in spite of all the corticosteroids, she had failed to put on any kind of weight, and in spite of all the DMARDs. She also complained of hair loss, aches and pains in the body. There were carious teeth. She had sensitivity to dust exposure, would always present with bouts of coughing, was very sensitive to odors, could sense them very fast, even the distant ones. So, if the husband never used to smoke, but he said that, if he has stepped out with friends who had been with him 3 hours prior and had smoked a cigarette next to him, he would come back and say, okay, take off your clothes because I can smell the cigarette on you. So she was that sensitive to odors. So later on, she also developed a lot of dryness in mouth, and thereafter she was diagnosed with Crohn syndrome. And another thing which she presented for in the past history, that was a tendency. So when you read the aphorism 153 of the Organon, he talks about striking, singular, uncommon, and peculiar. Now, what are peculiar symptoms? Peculiar symptoms are the tendencies that you have inherited. For instance, somebody has a tendency to catch cold. Somebody has a tendency for constipation. Somebody has a tendency for a diarrhea. These are what we call peculiar symptoms. Some things, for instance, there's a family history of diabetes in many people, and now I'm also a diabetic. So that is what we call a peculiar symptom, which are the predispositions and the tendencies that you've inherited or you have developed or noted in your past history over time. So since childhood, she recalled that she tended to have episodes of swelling of the parotid gland, usually on one side, and whenever that swelling developed is when she found she could not swallow anything solid. She could only take liquids, and she said, on and off, every year, 2 years, 3 years, I tend to develop this swelling. As a kid, my parents used to take me to the potter and put some mitti, kumhar ki mitti lagai jati hai, because they thought it is galsu or mumps, and they would treat it. And she said, but it was always one side, and 2 years later it was back, and it persisted on and off over the years. So with the DMARD and all the other medications, her joint pains were under control, but her Sjogren's is what was giving her major problem. There was persistent, irritating dryness of the mouth, and of course there was weight loss and her general listlessness, lack of energy. So the family history, father also suffered with rheumatoid arthritis and died with cancer. The paternal grandfather also suffered with rheumatoid arthritis. One of the brothers had hypertension, and she recently, because she continues to be under my treatment, so recently her brother, who was a hardcore alcoholic, just passed away with cancer. So that's another thing which we learned over time while following her up. So she suffered with malaria early in the years, then there was typhoid. Periods had always been regular, and married in 2005, developed 2 kids. Bowels were regular. Her weight at that point of time was 53.7 kgs. So in 2015, her CT neck showed some enlarged lymph nodes, and there was 40 deposition, and that the entire presentation CT neck suggested syndrome. And that's when they did the extranuclear antibody profile, and they found the Sjogren's antibodies to be positive. So her RA factor was high, anti-CCA at that point of time was under control, and ANA was also elevated. So the only thing which she recalled was the passing away of her father, to whom she was extremely, extremely attached. And with the extreme sensitivity which she had to the odors, the remedy was obvious, Ignitia Amara. And she received Ignitia Amara in ascending LM potencies. And her RA factor and CRP, which was repeated about a few months later, came down a little. CRP also came down a little, and she continued to improve under Ignitia Amara. And finally, in August 2019, she said, because we had decided that, after a few months of medication, when the levels improve, is then we will taper off the medicine. But she told me that, she becomes so fed up of the allopathic medicine that on her own, since May, she had discontinued the medications. the conventional medications, the DMARDs and all, suddenly. And she said, I never experienced any symptoms. I did not want to tell you because I thought I'll wait out. If I still have trouble, I'll probably get back on it. But she continued to be fine, continued on the ascending LM potencies of Ignatia Amara. And then that's somewhere in February 2020 is when she developed a persisting dry cough, and along with that dry cough is when she also developed a swelling unilaterally in the parotid gland. Now, she had symptomatically been doing fine. Her markers were also down, but that was one episode where her swelling in the parotid gland came back. Now, we went into there's few scant proving records that we have available of parotidinum, and we also found it produces many symptoms of swelling and pain in the joint as well. So that's when we shifted, and that's one problem which had been persisting in her entire anamnesis all through and had come back now with the episode of coughing. So that's when we shifted to parotidinum in LM potency, and we prescribed in ascending LM potencies. And the most interesting change which happened after nearly being an year on parotidinum is her CR became negative and her RA factor also became negative. And her joint pains never ever came back, the dryness in the mouth improved, and her eyes also improved, and her energy levels also improved. So parotidinum is a remedy which has never been proved properly. We just have a few clinical symptomatology which is available in the Materia Medica. You might be able to read a few of the indications in the Materia Medica of the Nosodes or in John Henry Clark's book, and even in the O.A. Julian's Nosodes, where you will find that parotidinum does produce symptoms of arthritis and rheumatology as well. So an empirical system as a prescription altogether, in this case from Ignatia, which was prescribed more at her mental emotional level, which was followed by because after about 2 years of being on an Ignatia is when the swelling in the parotid came back with a persisting cough, and she's prescribed parotidinum, and she's done really well, continues to do quite well. So this is all that I wanted to share with all of you. A few cases of autoimmune disorders that we have treated for over the last few years. Thank you so much. Have a lovely evening.